Hypertensive disorders during pregnancy can be divided into pre-gestational hypertension and pregnancy-induced hypertension. The chronic hypertension or the pre-existing one is known to be present before conception mainly, or can be firstly recognized before 20 weeks of gestation, and most of the time is idiopathic in origin, and the patient come asymptomatic. And you know that we diagnose it by at least 2 occasions of elevated blood pressure readings. On the other hand, when we have a sustained elevation in the blood pressure after 20 weeks of gestation, please remember this, it's an after 20 weeks of gestation, and the blood pressure must return to its baseline within the 12 weeks postpartum. This can be divided into gestational hypertension and the preeclampsia toxemia. And the difference is in gestational hypertension, we don't have proteinuria or any other manifestations of end organ damage. And the management mainly outpatient conservative and a frequent antenatal care visit with no need for antihypertensive medications most of the time. While preeclampsia toxemia, when we have proteinuria in this range or any symptoms of end organ damage such as confusion, epigastric pain, acute kidney injury, or any evidence for uteroplacental insufficiency. And you know that there are many risk factors for PET like to be primiparous, previous PET history, DM, obesity, and extreme maternal ages. So once you diagnose a patient with preeclampsia toxemia, the next step is to admit her and monitoring her and for her baby and delivery at 36 weeks and give magnesium sulfate as a prophylaxis. But once we have severe signs and symptoms or the systolic and the diastolic blood pressure readings within these ranges, then we have what's called severe PET. So we need for aggressive monitoring and termination of a pregnancy. And we give steroids for lung maturity of the fetus and magnesium sulfate. While when we have the dominant features of hemolytic anemia, which is mainly microangiopathic hemolytic anemia, elevated in the liver enzymes, and thrombocytopenia, then we have another severe subtypes of PET, which is HELLP syndrome, and we do the same management, and the cure is termination of pregnancy. But when the mother experiences one or more generalized seizure that cannot be contributed to any other CNS dysfunction, then this is called eclampsia. And the management is also termination of pregnancy, and we don't forget the magnesium sulfate. Thank you. I hope you are doing good.